Hypertension. It is a hemodynamic disorder, presents with elevated blood pressure. Around more than 1 billion people affected with hypertension, and estimated that about 9.4 million per year. Classification of hypertension. The normal blood pressure is systolic blood pressure less than 120 and diastolic blood pressure less than 80. Elevated blood pressure is 120 to 129 systolic blood pressure, and diastolic blood pressure is less than 80. In stage 1 hypertension, the systolic blood pressure is 130 to 139 and diastolic blood pressure is 80 to 89. In stage 2 hypertension, the systolic blood pressure is equal to or more than 140 and diastolic blood pressure is equal to or more than 90. Sometimes have isolated systolic hypertension, in which the diastolic blood pressure is normal and systolic blood pressure is greater than 140. And sometimes isolated diastolic hypertension, in which the systolic blood pressure is normal and diastolic blood pressure is more than 90 mmHg. Methods of blood pressure measurement. Office blood pressure and out of office blood pressure. In office blood pressure, the blood pressure is more than 140 by 90 is hypertension, and out of office hypertension at home is more than 135 by 85 is hypertension. The best method to assess the hypertension is ambulatory blood pressure monitor, in which 24-hour monitoring include daily life and sleep. In ambulatory blood pressure, the daytime blood pressure is more or equal to 135 by 85 is hypertension. In night time is more than or equal to by 70 is hypertension, and a 24-hour ambulatory blood pressure monitor ABMP is equal to or more than 130 by 80. Procedure in office blood pressure: minimum rest 5 minutes, arms and back are supported, feet on ground or floor, flat on floor, pressure taken in brachial artery, which is feasible and accurate value, and 2 times measurement. What is hypertension? White coat hypertension. It means increased blood pressure in healthcare providers. And masked hypertension, the blood pressure is normal or decreased in healthcare provider. The diagnosis look at both office and out of office measurements. Types of hypertension. There is 2 main type of hypertension. One is primary or essential hypertension, and second is secondary hypertension. Primary hypertension is 85% of total cases, and it have no underlying reason. 70% having the positive family history, results of interaction between genetics and environmental factor. Primary hypertension are not accompanied by symptom, so it is called silent killer. For chronic period, it damages the blood vessels, that is risk factor for myocardial infarction, aneurysm and strokes. Risk factor for primary hypertension: old age, obesity, family history, salt heavy diet, alcohol, smoking, and race. In secondary hypertension, 15% of total cases with underlying cause, the younger the patient, more likely to secondary hypertension. Causes of secondary hypertension. First is a renal cause. In renal cause, a renal parenchymal disease. One is acute glomerulonephritis, polycystic kidney disease, cluster of cyst develop in kidney, chronic nephritis, diabetic nephropathy, which is discussed in diabetes series, hydronephrosis. Hydronephrosis means excess fluid in kidney, also called obstructive uropathy, obstruction in ureter. Renal artery stenosis means narrowing of renal arteries. Renal producing tumors. Endocrine causes, adrenal disorder like Cushing syndrome due to the high level of cortisol for a long time. Second is primary aldosteronism. Third is primary adrenal hyperplasia, in which multiple nodules or lump formed in the adrenal gland. Pheochromocytoma, also a tumor of adrenal gland. Others. Hypothyroidism like myxedema. Hyperthyroidism like thyrotoxicosis. Hypercalcemia, acromegaly, excess growth hormone produced by pituitary gland, carcinoid or exogenous hormones like OCPs. Cardiovascular cause, coarctation of aorta means narrowing of large blood vessels. Polyarteritis nodosa means serious inflammation of blood vessels. Neurologic cause, psychogenic, porphyria, lead poisoning, primary dysautonomia or Relay-Day syndrome means dysfunction of autonomic system, sympathetic and parasympathetic dysfunction. Increased intracranial pressure or Guillain-Barré syndrome, in which the immune system attack on nerves. Guillain-Barré syndrome. Fifth is obstructive sleep apnea, preeclampsia or eclampsia, hypertension in pregnancy. Medication or toxins like high dose of estrogen, alcohol, drugs like oral contraceptive, anabolic steroid, decongestant, NSAID, COX-2 inhibitor, carbenoxone, sympathomimetics, cyclosporin, sibutramine, bromocriptine, and erythropoietin. Eighth is stress, post-operative, pain, burn, hypoglycemia, alcohol withdrawal. Ninth is cause of isolated systolic hypertension, atherosclerosis, which is discussed in diabetes series, aortic regurgitation, inadequate closure of aortic wall during the diastole that result in reverse blood flow through the aortic wall. Patent ductus arteriosus, connection between the two arteriole in the heart, that is a developmental defect. Thyrotoxicosis or coarctation of aorta.